Hi, fabulous ones. Brandy Lytle of Not So Mommy here. Last time we talked, I mentioned that I was getting ready to go in and have quite a few doctor's appointments. And like I said last time, it might seem kind of strange that I'm sharing some personal medical appointments and issues with you, but it's been weighing heavy on my mind that I needed to get on and give an update. And one of the reasons is I've shared that my dad passed away from colon cancer when he was only 51 years old. He had stomach problems his entire life, and as an adult, he got diabetes. And so he often ignored things, thinking that they were just normal for him. So when he was diagnosed with colon cancer, it was already stage 4 and it had already spread. And so although he battled courageously, ultimately he lost that battle. Well, I've also shared that I have endometriosis. And so that means that a certain level of pain and fatigue comes with having that disease. Well, I don't want to get into the habit of thinking that things are normal and to ignore things that are going on with my body. So I am very conscientious about going for the yearly checkups and going for screening procedures so that I can make sure everything's okay. So I went for my well woman exam. Everything was fine. I went for my mammogram. I had to have a follow-up ultrasound, and I'll have to go back in 6 months just to make sure that what they found was normal for me. And having that mammogram allowed me to have conversations, realizing that a 3D mammogram would probably be better for me because I have dense tissue, which led to conversations with my mom, which made me find out that that runs in our family. I had a colonoscopy, not the most fun procedure in the world, but also not the worst thing. And it is much better than the alternative and what my dad had to go through. And I'll go up for a follow-up appointment on Monday for that. But the doctor said she thought everything was fine and what she found was benign and that I didn't have anything to worry about. I also went to the dermatologist. I have fair skin. I have a lot of freckles, but I got the all clear that everything was fine. And I saw a sign at the dermatologist that said 95% of skin cancer is completely treatable if found early. And so I'll take a little bit of time and I'll go to the dermatologist and I'll wear my sunscreen every single day and wear a hat when I'm outside and do all these things just to make sure I'm protecting myself. I do still need to go to the dentist. That may sound silly, but keeping your gums healthy keeps germs from getting into your body. And the dentist also checks for mouth and throat cancers. So I just want to, one more time, encourage you to go to those doctor's appointments. I know they're not always fun. Trust me, I had quite a bit of anxiety before I went in for that colonoscopy. My endometriosis was really flaring up because nerves and anxiousness causes my pain to increase, but I did it. And now I know what it's all about, and now I know everything's okay and I don't have to worry. So get in for those appointments. Make sure you're not ignoring things and that you're taking care of yourself and that you are making sure that you can live a long and healthy life.